Have you ever noticed someone in your life exhibiting changes in their memory, thinking, or behavior that made you wonder if it might be something serious, perhaps even dementia? It can be a very concerning experience, but it is important to know that these symptoms are not always what they seem. Many different conditions can indeed present with symptoms that look a lot like dementia, making it tricky to pinpoint the exact cause without a proper medical evaluation. This is precisely why seeking professional help is so crucial for an accurate diagnosis and appropriate care. The human brain is incredibly complex, and a wide array of factors can disrupt its normal function, leading to cognitive changes. Some of these conditions are actually reversible. For example, certain vitamin deficiencies, especially a lack of vitamin B12, can cause memory issues and confusion. Thyroid imbalances, like an underactive thyroid, can also slow down brain function and mimic cognitive decline. Even simple infections, such as urinary tract infections in older adults, can suddenly lead to confusion and disorientation. Moreover, side effects from certain medications, depression, anxiety, or even excessive alcohol use can all impact cognitive abilities in ways that resemble dementia. There is also a condition called normal pressure hydrocephalus, where excess fluid builds up in the brain, causing issues with walking, bladder control, and thinking, which can often be treated. Beyond these treatable causes, other neurological conditions can also mimic dementia. Conditions such as the aftermath of a stroke, Parkinson's disease, or Lewy body dementia can all involve significant cognitive changes that might initially be mistaken for Alzheimer's or other forms of dementia. Each of these has its own distinct set of underlying mechanisms and progression, but their impact on memory, reasoning, and behavior can overlap. Understanding these diverse possibilities highlights why a comprehensive assessment is not just helpful, but absolutely essential. It is about looking beyond the surface symptoms to uncover the true root cause. So, what should you do if you or a loved one are experiencing these kinds of concerning changes? The most important first step is to schedule an appointment with a doctor, preferably one who specializes in brain health, like a neurologist. Before your appointment, it is incredibly helpful to prepare a detailed list of all the symptoms you have noticed. Include when they started, how often they occur, and any factors that seem to make them better or worse. Also, bring a complete list of all current medications, including over-the-counter drugs and supplements, and be ready to discuss your medical history and lifestyle. This detailed information will provide valuable clues to your healthcare provider. A thorough diagnostic workup is key to differentiating these conditions. This often involves a series of tests, which might include blood work to check for deficiencies or infections, detailed neurological examinations, cognitive assessments to evaluate memory and thinking skills, and sometimes brain imaging such as an MRI or CT scan to look for structural changes. An early and correct diagnosis is a game changer. For reversible conditions, it can mean a full recovery, while for others, it allows for targeted management strategies that can significantly slow progression or improve daily living. This detective work by medical professionals is incredibly valuable. Ultimately, understanding that dementia-like symptoms can have a variety of underlying causes, some of which are treatable, offers a significant sense of hope and purpose. It underscores the critical importance of seeking professional medical advice at the first sign of concern. An accurate diagnosis opens the door to the most appropriate care plan, which can truly make a difference in maintaining cognitive function, improving overall well-being, and ensuring the best possible quality of life for the individual and their family. Do not hesitate to advocate for a comprehensive evaluation.